A violence prevention campaign in Mattapan is getting off to a new start, supported by federal, city, and community agencies. The campaign is called Our Mattapan, Many Pasts, One Future. To tell us about the campaign's relaunch are the program manager for violence intervention and prevention with the Boston Public Health Commission, Albert Altin, and the coordinator of family and community health services at the Mattapan Community Health Center, Sharon Callender. Thank you both very much for being with us.
Thank you, Chris.
Thank you.
I want to start with Sharon. Talk about the history of this program, because this starts, I guess, a couple of years before this, and I guess that was in response to problems that went back even further.
Right. We've been fortunate to be funded through the Boston Public Health Commission for 5 years, going into our 6th year of funding, to be able to address violence intervention and prevention from, as I would say, a public health perspective. The need came out of the increase in violence in Boston communities 5 years ago, and Mattapan was one of the neighborhoods that really benefited by the services and the funding that we received from the Commission. So with that, we were able to go out into the community under the leadership of a VIP coordinator and block captains who would basically do door knocking, go and knock on doors, talk to the community residents, and also see what's going on in the community, and also try to empower them to somewhat take back their neighborhoods, to look at whether the street lights were on, to see whether the streets were clean, to see whether or not there were areas that we could improve to deter the incidents of violence.
Albert, one of the things that I got from looking at some of the videos created around the campaign is it's just about getting people to think positive, to look at their neighborhood as a good place with good people.
Right. This is really a social norms campaign, and the idea behind it is that oftentimes when negative things happen in the community, there's a light that shine upon that, but then when the positive things are happening, we don't hear too much about that. And so we wanted people to know that Mattapan is a good place to live. We have wonderful people here. The people are great. They want to be involved in their communities, and VIP is a mechanism for them to get involved and for them to really show leadership and collaboration with all the people and partners that we work with.
Sharon, I imagine one of the other intentions here is for people to know more about the neighborhood. I mean, yeah, these are good things, they're feel-good messages, but I guess a lot of people haven't heard them or seen them.
Well, it's not just, I think the messages are important, especially where the messages are from the residents who live in Mattapan. They're not actors or actresses. And most of them have been longtime residents of Mattapan, have seen the transition in Mattapan and also the improvements in Mattapan. So they have an investment in the community and want to show that Mattapan is a good place to live. It's a positive place to be. That Mattapan has things that people would want to come to visit. We have a great library in Mattapan. We have a brand new health center. We have a teen center. We have community centers. And that there are people here who really are interested in keeping the community safe. So to not forget about us when you talk about other communities, but as Albert said, to really talk about not just the negative things that happen in Mattapan, but the positive things that are going on in Mattapan.
Albert, what about the way this campaign is being revamped?
Really, the revamp of the campaign focuses in on the last piece of the tagline, which is one future. And so within the ads, there are a variety of different people, residents, who talk about some of the things that have happened in the past. But now we're really talking about mobilizing ourselves to creating that one future where Mattapan is really seen as a part of the neighborhood that people want to live in, people want to invest in, and really focusing in on that. There's so much happening right now in terms of a variety of organizations collaborating with one another and really wanting to engage residents even more so that they are a part of that system. They are a part of that collaboration as well.
Sharon, one of the main things going on in this campaign is you're looking at violence as a public health issue. What does that mean when you look at this as a health issue?
Well, when you look at violence, it affects the physical, social, and psychological components of your health. So therefore, when you look at that, you also have to see how violence and or trauma affects individuals. So if you are a victim, and even if you are the perpetrator and or their families also are affected by violence. So when we look at it from a public health perspective, we have to say how healthy is the person, but also how healthy is the community where the person is living. in how we can change that. And so for me, being someone that has always worked in public health for the last 20, 25 years, I see it as a public health effort that we need to deal with. And that's why the health center has been in the forefront to try to address this in our community through the VIP program.
Albert, how can people in a neighborhood do something about those public health issues? What's the course of action you want them to follow?
Really, it's about finding out and being aware of what is in the community, and really seeking out to be a part of it. There are so many people that we collaborate with that they're oftentimes looking for people to take the lead on or to be a part of what's going on in the community. So it's really providing an avenue, a vehicle for them to, if it's a couple of hours that they can provide, or if they can spearhead something that's happening, but really looking for residents to take a part and join in the efforts that's going on. It can be as easy as picking up the phone and calling the mayor's constituent line, the 4500 number, and reporting that there's a light out in my particular street. Can someone come and take care of that? It's knowing about what resources are available for the young people for out of school time and being able to share that with the neighborhood. But most importantly, it's really around social cohesion as well, really taking care of ourselves and our neighbors in our neighborhood to really get people to mobilize.
Sure, I know this campaign has been playing out over time in which it looks as if maybe violence is declining in this part of the city, but there was a somewhat controversial billboard that came out as connected with a violence interrupter in the program. And I guess one of the things here is just to get people talking, maybe.
Yes, and I think if you look at the billboards, if you're going on Blue Hill Avenue going towards Milton, or even if you're coming away from Milton, they're right in Mattapan, they're in the center of the island. And if you look up, you'll see the flags on the poles. And also if you look up higher, you'll see them on the billboards. And I think the whole message is to say, Mattapan is a safe place. Mattapan is a good place. There are individuals here that are invested. There are residents here, hardworking individuals who want to make sure that the community is safe, that there are resources for their children, there are activities for their children, and that we should not always only have to hear the negative about Mattapan. Talk about those good things that are going on in the community.
Albert, if people want more information about this, I think you've got something provided by the Department of Public Health Commission, rather?
Right, so they can go on to the Boston Public Health website, which is www.bphc.org, or they can also type in our Mattapan Many Past One Future, and they'll be able to find us there as well.